Procedure to measure visual acuity. 1. Ensure that the chart is at appropriate distance and is calibrated correctly. Leave the room lights on and illuminate the chart. If you are going to measure both vision and habitual VA, measure vision first to avoid memorization. To measure vision, ask the patient to remove any spectacle. To measure habitual visual acuity, ask the patients to put their distant vision spectacle on. 4. Measure the visual acuity of the poorer eye first. If a poorer eye is known from previous records or from the case history, otherwise measure VA in the right eye first. Explain what measurement you are going to take. This can be as simple as we shall find out what you can see in the distance. Instruct the patient. Please cover up your left or right eye with the palm of your hand or this occluder. If using the patient's hand, make sure that the palm is being used, as otherwise the patients may be able to pick through their fingers. Some clinicians prefer to hold the occluder over the patient's eyes themselves to ensure it is properly occluded. Ask the patient, please read the smallest line that you can see on the chart or similar. Continually monitor the patient's facial expressions and head position. Do not permit the patient to screw their eyes up or look around the occluder or through their fingers. Once the patient has reached what they believe are the smallest letters they can see, they should be pushed to determine whether they can see any more. Use prompts such as, "Can you see any letters on the next line?" or "Have a guess, it doesn't matter if you get any wrong." Some patients are more cautious than others and only indicate those letters that can be seen easily and clearly. Unless you push patients to guess, you could obtain different VA results depending on how cautious your patient is. Ideally, you should stop pushing patients to read more if they make 4 or more mistakes on a line of 5 letters. If patients cannot see the largest letters on the chart, ask them to move closer to the letters until 2 or 3 lines can be seen. The distance at which this occurs should be noted. This is more accurate assessment than determining the positions that the patients can count fingers. If the patients cannot see the letters even at the closest test distance, use the following test sequence. Stop at the level of which the patient can accurately respond. Hand movement at Y centimeters. The patients can see a hand moving from a certain distance. Light perceptions. The patient can report which direction light is coming from when you hold a pen light about 50 centimeters away. Light perception. The patient cannot see the light but not where it's coming from. Record vision or VA. Repeat measurement for the other eye and binocularly.